Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Prenatal Care Introduction. Prenatal care is the care a woman gets during pregnancy and before her baby is born. Getting early and regular prenatal care is important for both the mother and the developing baby. Prenatal care includes health care, education, and counseling about how to handle pregnancy. This program will help you understand prenatal care. It discusses food and lifestyle changes as well as what to expect during prenatal visits. The need for prenatal care. Prenatal care can help keep you and your baby healthy. Your healthcare provider will schedule you for many checkups over the course of your pregnancy. Don't miss any. They are all important. Healthcare providers can spot health problems early when they see mothers regularly. This allows healthcare providers to treat any problems early. Early treatment can cure many problems and prevent others. Healthcare providers also can talk to pregnant women about steps they can take to give their babies a healthy start to life. Babies of mothers who don't get prenatal care are 3 times more likely to have a low birth weight. They are also 5 times more likely to die than those born to mothers who do get care. Prenatal Healthcare. Prenatal healthcare is when your healthcare provider makes sure you and the baby are healthy at each visit. If there are any problems, early action will help you and the baby. This is why it is important to get early and regular prenatal care. The following discusses some tips for prenatal health care. Make sure to take a multivitamin or prenatal vitamin with 400 to 800 micrograms of folic acid every day. Folic acid is most important in the early stages of pregnancy. However, you should continue taking folic acid throughout pregnancy. Ask your healthcare provider before starting or stopping any medicines. Some medicines may cause problems during pregnancy. Stopping medicines you need can also be harmful. While pregnant, try to avoid X-rays. If you need X-rays, tell your healthcare provider you are pregnant. This way, extra care can be taken. Pregnant women should also get a flu shot. Women who are pregnant can get very sick from the flu and may need hospital care.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Food. A woman's diet may also affect her pregnancy. This is why prenatal care also includes tips on how to eat healthy while pregnant. The following discusses some tips for healthy eating during pregnancy. Make sure you are eating a variety of healthy foods during pregnancy. Choose fruits, vegetables, whole grains, calcium-rich foods, and foods low in saturated fat. Also, make sure to drink plenty of fluids, especially water. Getting all the nutrients you need each day is also important while pregnant. For example, getting enough iron prevents you from getting anemia. Anemia can cause preterm birth and low birth weight. Ask your healthcare provider if you need a daily prenatal vitamin. Always wash fruits and vegetables before eating. Don't eat uncooked or undercooked meats or fish. Make sure you handle, clean, cook, eat, and store foods properly. This helps prevent foodborne illnesses. Also, don't eat fish with lots of mercury. This includes swordfish, king mackerel, shark, and tilefish. Lifestyle. Being pregnant may also require some lifestyle changes. The following includes some tips on what to do and what not to do while pregnant. Women should gain a healthy amount of weight while pregnant. Talk to your healthcare provider to learn what a healthy amount is for you. Unless your healthcare provider tells you not to, try to get at least 2 hours and 30 minutes of aerobic activity each week. Aim for a moderate level of intensity. Also, it is best to spread your workouts throughout the week. It is important to get informed during your pregnancy. Read books, watch videos, and talk with moms you know. You can also ask your healthcare provider about childbirth education classes to help you prepare for the birth of your baby. Other tips for a healthy lifestyle while pregnant include: don't smoke, drink alcohol, or use illicit drugs. Don't take very hot baths or use hot tubs or saunas. Get plenty of sleep. Find ways to control stress. Environmental. Prenatal care also involves some environmental tips to keep you and your baby healthy. The following discusses these tips. While pregnant, you should stay away from chemicals. These include insecticides, solvents like some cleaners or paint thinners, lead, mercury, paint including paint fumes. Not all products have pregnancy warnings. If you're unsure about the safety of a product, ask your healthcare provider before using it. If you have a cat or garden and are pregnant, ask your doctor about toxoplasmosis. Toxoplasmosis is an infection caused by a parasite sometimes found in cat feces. If not treated, toxoplasmosis can cause birth defects. You can lower your risk by avoiding cat litter and wearing gloves while gardening. You should also avoid contact with rodents while pregnant. This includes pet rodents and their urine droppings or nesting material. Rodents can carry a virus that can be harmful or even deadly to your baby. Take steps to avoid illness while you are pregnant. One way to do this is by washing your hands frequently. While pregnant, you should also stay away from secondhand smoke. This can harm both you and your baby. Prenatal visits. Getting early and regular prenatal care is important for both the mother and the developing baby. Your healthcare provider will give you a schedule of all the prenatal visits you should have while pregnant. Most experts suggest you see your healthcare provider about once each month during your first 6 months of pregnancy, every 2 weeks during the 7th and 8th months of pregnancy, weekly in the 9th month of pregnancy. You will probably see your healthcare provider more often if you are older than 35. This may also be true if your pregnancy is high risk. During the first prenatal visit, you can expect your healthcare provider to ask about your health history, including diseases, operations, or prior pregnancies. Ask about your family's health history. Do a complete physical exam, including a pelvic exam. Your healthcare provider will also do the following during your first prenatal visit. Take blood and urine for lab work. Check your blood pressure, height, and weight. Calculate your due date. Answer your questions. At your first prenatal visit, you should ask questions and discuss any issues related to your pregnancy. Find out all you can about how to stay healthy. Later prenatal visits are usually shorter than the first. During these visits, your healthcare provider will check on your health and make sure the baby is growing normally. Most later prenatal visits will include checking your blood pressure, measuring your weight, measuring your abdomen to check your baby's growth, checking the baby's heart rate. While you're pregnant, you will also have some routine tests. Some tests are suggested for all women, such as blood work to check for anemia, your blood type, HIV, and other factors. Tests may also measure the risk of gestational diabetes and look for harmful infections. Other tests during pregnancy might be offered based on your age, personal or family health history, ethnic background, results of routine tests.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Prenatal care is the care a woman gets during pregnancy and before her baby is born. Prenatal care includes health care, along with education and counseling about how to handle pregnancy. It also includes food, lifestyle, and environmental tips to keep you and your baby healthy. Getting early and regular prenatal care is important for both the mother and the developing baby. Healthcare providers can spot health problems early when they see mothers regularly. Early treatment can cure many problems and prevent others.
Thank you for using Explain.